Have you ever wondered what happens during a root canal? And is it really as scary as it sounds? Did you just say root canal? Oh no. In this video, I'm going to break down a root canal step by step for you so that it can hopefully make it less intimidating for you, especially if you were told that you need a root canal or you're scheduled to get one. So a root canal is a common procedure that's done to save a tooth that has been severely damaged or infected. Usually it all starts with a cavity. A cavity is a hole that forms in your tooth. Now, how does this happen? Well, you have these bacteria that live in your mouth and they feed on the carbohydrates that we eat. So anytime we eat sugar or potato chips or anything starchy, all of this will enter our mouth and start feeding these bacteria called Streptococcus mutans. In turn, these Strep mutans bacteria will release lactic acid as a byproduct, and this will sit on our teeth and slowly demineralize our teeth. Over time, this can keep getting worse, and eventually a little hole can form in our tooth. Now that hole can keep getting bigger, especially if it's never addressed. Once a cavity passes through your enamel, which is the outer defense layer of your tooth, it reaches your dentin. Your dentin is a lot weaker and it's easier to spread. So that means a cavity can start spreading faster and faster. And this cavity will keep growing and it'll start spreading closer to the inside of your tooth, or the pulp. Once it gets here, or even when it gets close to here, your tooth can start getting really painful. Now, this isn't the case for everybody. I've seen people that have huge cavities into their nerve and they never feel anything. Your dental pulp contains all your blood supply and nerve supply for that tooth. And that blood and nerve supply is innervated by these canals that are in the apex of that tooth. So your tooth has two parts. It has the crown and it also has the roots. The crown of the tooth is what you see. It's above your gums. It's what you see when you smile or when you chew food. And the roots of the tooth, just like the roots of a tree, are hidden. They are underneath the gums and they're inside the bone. But inside of those roots are these little tiny canals that get fed that blood supply and that nerve supply. And those canals, if you follow them, will lead to the inside of the tooth or the pulp. Now, once these bacteria that are in this cavity start entering the dental pulp, this is when you're going to need a root canal, because those bacteria can start traveling down those canals and lead to an infection or a lot of inflammation. This is called pulpitis. And this is usually when it can get really painful, but still in these cases, sometimes it's still not painful. Some people I just don't understand. But it might not just be tooth pain you got to worry about. It could also lead to an abscess or a big infection. And this infection can start eating away the bone that surrounds the tooth, because these bacteria spread from the pulp down these canals into the apex of the tooth where all your bone is, and they can start eating away the bone. And if this keeps spreading and it's never addressed, then it can start affecting other teeth, other areas of your jaw, and even spread to the rest of your body. And you could even lose that tooth. Now, this is why you need the root canal. In a root canal, you're cleaning away all the nerve supply and all the blood supply, and you're cleaning out those canals so that that infection will go away. Now, there could be some other reasons that you would need a root canal too. It could be a really big crack or a fracture that goes into your nerve that causes a lot of pain. Sometimes if you have multiple dental procedures on the same tooth, it just kind of responds in a way where it needs a root canal, because anytime you work on a tooth, you start removing healthy tooth structure. Anytime you replace a filling or put a filling for the first time, and that will slowly start damaging your pulp. And even doing a couple fillings on a tooth in some people might lead to them needing a root canal. You could also have gum disease that gets so bad that it spreads into your bones and into the apex around your tooth that starts infecting your tooth from the bottom. You could also get resorption, where it starts eating away the inner part of the tooth. There are a lot of reasons that someone might need a root canal, and I'm actually going to make a separate video where I go into detail about all these issues and more, which could lead to you needing a root canal. But now it's time for what we all came here for, the step-by-step procedure of a root canal. So first off, your dentist will diagnose the problem. You'll come in probably with some severe pain. They'll figure out which tooth is causing the problem, or which teeth if it's multiple problems. And then they'll probably take an x-ray to see exactly what the roots look like. Sometimes dentists will take a 3D scan of your teeth so they can see the root structure in a 3D image. Then when they're going to start the procedure, they will give you some local numbing. Usually it's with lidocaine. There are some other types of numbing that are used, and I'm not going to bore you with those. But this local numbing will numb the teeth and also all the tissues that surround those teeth, so you won't feel anything during the procedure. Then the dentist has to isolate the tooth. The dentist will do this by using a rubber dam. This rubber dam will surround that one tooth and prevent any saliva from getting onto the tooth, keep the tooth dry, and also isolate it so that no bacteria get in it, so that once you do the root canal, that it's a very clean environment, so that you don't risk that area getting infected again. And then once you're all numb and this rubber dam is put over the tooth, the dentist will start removing the cavity. Sometimes the cavity is so big that a whole wall of the tooth is blown out. Some dentists will restore that wall before continuing with the procedure. Basically, it's doing a filling before the root canal is completed. I personally do root canals this way. Every doctor is different. Then once the cavity is all removed and you have clean tooth structure, the dentist will start entering the pulp if they're not into it already. They'll start by making a small opening in the top of the pulp chamber, which is the tooth structure that sits right over the pulp, and then they will start cleaning out any of the infected pulp. Once that's all cleaned, then they will start looking for all the canals in that tooth. Every tooth is structured differently, and every tooth has a different number of canals. Your front teeth typically just have one canal that's feeding the tooth, but your back teeth will have more canals. Sometimes your molars will have 4 canals or sometimes even more canals. But it's really important that your dentist finds all of these canals because all these canals are places where infected tissue can lie and lead to a recurrent infection later on. Once all these canals are found, they're all cleaned and shaped using a series of files. Sometimes a dentist will use a motor handpiece. Actually, usually that's what dentists use nowadays, is a handpiece that has a file on it that will shape all these canals. The dentist will also put some irrigants in these canals. So these irrigants are what help clean out these canals. The main irrigant that is used in these canals is called sodium hypochlorite or bleach. I know you might be thinking, bleach inside of my tooth? Well, yes, just like you clean your house with bleach, the dentist will use bleach to clean inside the canals. This is also partly why the rubber dam is used, to protect you from any of this irrigant. This irrigating will kill all the infected tissue and also kill all the organic tissue that's in those canals. This is actually one of the most important parts of a root canal, because if things aren't irrigated and cleaned properly, then you can still have a lot of pain afterwards or have other issues like a new infection later on. Once everything is all cleaned and shaped really well, then the dentist will put a biocompatible material in each of these canals to seal them all off. This will also prevent future infections because let's say some bacteria get down their way by these canals. Well, now they'll be stuck because they have this material that's blocking all the canals. Then once all these canals are sealed, then the dentist will either put a filling or a temporary crown on the tooth. Usually when a root canal is done, it means that that tooth will need a crown, especially on the back teeth, because when you do a root canal, you're not only killing the nerve supply, you're also killing the blood supply. And when that tooth has no more blood supply, it can get a lot more brittle and easier to break. A crown is basically this ceramic cap that goes 360 degrees around the tooth to protect it. Now, a crown isn't always done. Sometimes you can just fill that hole with a filling. I would just leave it up to your dentist. But just know that sometimes you have to come back for a second visit. Actually, usually you will. And a lot of times people will even do a root canal in 2 visits, where they start cleaning out the canals, and then for one reason or another, they might want to finish that root canal in a second visit. And then you might have to come back to get a crown prepped, and then you might have to come back another time to get that crown seated. Because usually when a tooth gets prepared for a crown, they have to send some impression or take a scan, which is basically a series of pictures, and send that to a lab to design the crown, and then you have to come back to get that crown put on. Now, what can you expect after a root canal is done? Sometimes you might have some soreness or mild discomfort, and it's not usually because the tooth itself is painful, but because the ligaments that are around that tooth. So when your tooth is in the bone, you have these ligaments that surround all those roots. Sometimes those get a little irritated when a root canal is performed, and that takes a few days to go back to normal. Usually these can be managed with over-the-counter pain meds, and sometimes you might have to be prescribed something by your dentist depending on your pain tolerance. You could also have some soreness around your gums, and your mouth just might be sore from being open during the procedure. I will say though, for a lot of my patients, after a root canal is done, they have no discomfort whatsoever. But if they do have any, it's usually subsided in a day or 2. Whatever the case is, I would definitely follow your dentist's tips and post-care instructions, because only they really know your case, because every case is pretty unique. In terms of the timing of the procedure, you can expect it to take between 1 to 2 hours. It really depends on the dentist. Sometimes people are faster, sometimes people take their time. And how long do root canals last? That's another really common question I get. This is a really hard question to answer, because in dentistry, a lot of the studies that we have are only for 10 years. Like a lot of the clinical trials, they don't go past 10 years for one reason or another. Usually it's because of lack of funding, and Also, in dentistry, they say like, if something lasts for 5 to 10 years, then it's already successful. There's no reason to keep studying it. And after 10 years with root canals, the success rates vary a little bit, but they're usually pretty high. This study that I found a 93% success rate for root canals after 10 years. But I will say that nothing in dentistry lasts forever. The moment you work on a tooth, even a small filling, that tooth gets weaker because it's depleted of its enamel and its natural tooth structure. There's nothing we have right now that can replace a natural tooth. There might be something in the future, but not right now. Now, with that being said, for some people I have seen a root canal and crown last a whole lifetime. But the goal really is to get as many years as you can out of that tooth. And the goal is also to prevent that tooth from being extracted, or at least delaying it as long as possible. And also part of the reason it's hard to answer is because it really depends. Some cases you'll have a lot of healthy tooth structure remaining even though you got a root canal. And in some cases you'll have very little healthy tooth structure remaining. And we're basically holding on for dear life and hoping for the best. The main purpose of a root canal is to save a tooth that would otherwise have to be extracted. So no matter what, I would always choose to prolong the lifespan of my tooth as long as possible because we only get one set of adult teeth. And I do want to point out there has been a lot of misinformation floating around the internet about how root canals can potentially cause cancer and heart disease and other problems. There was also a Netflix documentary out that was exposing root canals, but it later got taken down for misinformation. Just know that root canals, especially with modern technology, are a completely safe procedure. And some of those claims that root canals cause cancer are completely false. And I actually made a separate video specifically on this topic, and I'm putting that in the description below, so make sure you check that out if you're interested. I do also get questions about root canals if they function just like a normal tooth. Yes, you can still eat with it and smile with it just like a normal tooth because at the end of the day, it is your normal tooth. The only difference is since the nerve supply is cut off, you won't feel any sensitivity or anything with it. But you still can feel the pressure with it because you have these pressure sensors in the ligaments that surround your roots. So you'll still feel the pressure when you're chewing and stuff like that. I also get asked a lot of times if root canals hurt. And I think the main reason people are so scared of root canals is because they're associated with pain. Because a lot of times when people need a root canal, it's because they're in pain. But the whole point of a root canal is to get you out of pain. So root canals don't really hurt themselves. Like the procedure itself, you'll be numb, you won't feel anything. But it might be painful going into it because your tooth might be infected or have a lot of inflammation or something wrong with it. I usually tell patients it's just like a filling, it might just take a little bit longer. So to sum it up, a root canal is a straightforward procedure, very common, and it's done to save your tooth. So if you need a root canal or you're scheduled to get one, I hope that this video helped a little bit to clarify what's gonna happen. I really hope it didn't scare you. Now, if you did find this video helpful, make sure you hit the thumbs up button and subscribe to my channel. Even if you didn't find it helpful, still hit the thumbs up button and subscribe. And thanks for watching. I'll see you guys in the next video. Did you know that there are different types of fluoride that can be in your toothpaste? If you look at the back of your tube of toothpaste, you might see one of two common active ingredients, either stannous fluoride or sodium fluoride. So in this video, I'm gonna break down the key differences between these two different types of fluoride so that you can help figure out which one is best for you. Now, first of all,